Excellent. Thank you very much. So I will present a really cool company, Intelligent Implants. This is a medical device company, and we say we are at the intersection of digital medicine and orthopedics. You can say, in essence, what we do is that we 3D print bone inside your own body. And we're able to monitor this healing remotely in real time. So not only do we heal the patient safer and faster, we can also monitor this healing. This technology is put into standard orthopedic implants. There is no change in any surgical procedure for the surgeons. They hammer it in the way they always do, but they get all these added benefits for free. Okay. The technology is applicable throughout all orthopedic implants, where it's beneficial to grow bone faster and safer. Right? We start in spine. So, spinal fusion procedure, it's done when the disc in between two vertebrae has been damaged. So the surgeon removes this damaged disc and put in what they call a cage or a spacer. And then they want the vertebrae to fuse together, as in the picture over there. Steloperation in Swedish. This is a very common surgery. It's done about 1.4 million times every year. It's extremely costly and it's very invasive. The problem is that it fails way too often. It often fails due to what's called a non-union. And what that is very simple. It's that the bone does not fuse together. You don't get this bridge of bone from one vertebrae to the other. This is a very common cause for a reoperation. And if you need to undergo a reoperation, chances are even higher that it will fail again. And what happens actually is that these patients very often never recovers, and they have to live a life on pain medication. So, electric stimulation, it's the body's own way to signal for bone growth. So every time you stress your bones, small electric signals are being sent to the osteoblasts, come here and build bone. So you can say that we hijack these signals and we put them through an array of electrodes to get these signals for bone growth exactly where we want the bone to grow. It's a very well-patented system. We got breakthrough device designation from the FDA. And as you see, there's no battery or any hanging wire because it's all powered wirelessly through induction that I will show in a bit. You see there, we stimulate the bone to grow very, very powerfully, but we can also monitor the bone growth. And we can monitor the bone growth by using the same electrodes here that we use for stimulation to temporarily stop the stimulation, and then we send a little signal from one electrode to the other. And as bone grows, since it does not conduct very well, the impedance value will go up as you're healing. So what you will get is like a healing curve telling objectively when a patient has been healed. So how it's done today is basically you go in and you have CTs or X-rays. We will definitely lower the amount of needed X-rays and CTs, hopefully even remove them. And it's all objectively and not subjectively. So here are the three components of the system. It's the smart cage that we put in between the vertebrae. And there's the E-cap. It's a medical wearable that you wear that actually sends power to the device. Almost like when you charge your iPhone, but you need to go over a much larger distance. Sends energy, the implant will heal you, and then the implant will retrieve the impedance data, send it back to the E-cap sends it onto the cloud, and then onto this physician's desktop, so they can monitor the patient's healing. And there's a patient's app as well, mainly for compliance. So how does it work? How does this implant heal better than before? So we test this by putting 2 implants into a sheep. So we put in one of the implants, we have the stimulation on. In the other implant, the stimulation is off. And then we measure the difference in bone volume, how much more bone do we grow when we have the stimulation on, and what's the bone quality. At the bone quality, we look for the trabecular thickness. And it turns out it's fantastic results, incredibly good. So we have 3 times more bone when we stimulate versus when we don't stimulate. And it's also extremely good bone quality. And this data that you see here, it's an average of 5 sheep. And you can see here that in every implant that we stimulate, much more bone versus the unstimulated. Stimulated, unstimulated, so forth. The market for this is obviously big. If we break it down to only look at the lower back, so the lumbar spinal fusions, and we only look at EU and US, we have a serviceable obtainable market of about 2.8 billion euros. It takes a long time to build this company. We discussed over lunch how long time it takes. You don't know this when you found the company. We spent about 10 million to date, and we are very close. So we did this great animal studies that you saw back in 2019, and now we spent the last couple of years to actually find a way to produce this industrialized, so we can produce it at scale. We have a really nice supply chain from, and are very close of being able to produce to do the first in-human study. So that's what we're doing now, raising 5 million euros to actually perform the first in-human clinical study towards the end of next year. This is the by far most value-added milestone to date. We got this technology now extremely small throughout so many years of optimizations that we can put this into almost any orthopedic implant where it's beneficial to grow bone faster and safer and to monitor the sealing remotely in the process. But we need to stay really focused now on the first product, but it's hard not to look at all these other applications that are out there. Here's the team. We sit right here, the northern tower on the 6th floor. Here are my contact details. If anyone wants to come by and visit and actually look at the implant and feel them and see us demonstrate them, you're more than welcome to come by. Just send me an email and we set up a time for that. That's it. That was a short one. Thank you.
Thank you very much. If you have any questions to Martin, please raise your hand. Yeah, we start off here.
Very speedy. So.
Yeah.
Perhaps first of all, a little bit about the clinical study.
Yes.
In the sheep, you did 2 vertebrae, or 2 discs, basically.
That's correct, yes.
Because you can do whatever you want with the sheep. But presumably you can't do that with a human being.
Nope.
Or how will you then compare sort of between your version and another version? Or how is it going to be done?
It's a really good question. We know already now what's the average healing time, but you could also tell from the sheep it's very individual, right? All these sheep that we did in this trial, it's super different from one sheep to the other, but we see so potent results. So the sheep heal twice as fast when we stimulate versus when we don't stimulate. So we would estimate also that the patients will heal twice as fast. And what we have here is in an ideal world, we could do many CTs and X-rays on the patients, right? But obviously we're pretty limited when we do this trial. But what we will have is the impedance data. So you will see it very clearly flatten out once they're healed. Hopefully we think we will show in this very small study. It's only will be 10-patient study. But we think it's so potent that we will see actually with these few patients a much quicker recovery.
So compared to a sort of general average, not
Yes.
a placebo study within the study.
Exactly. But we are evaluating. We can go into some detail if you like. after this, but we are evaluating some setups where we could actually check this for the patients. That would be a multi-level study.
And presumably also you would have to work with patients directly. You cannot do this in healthy volunteers.
Nope. This will be for patients. And that's one thing about this, why it takes so long time. When we put in this implant into the first patient, that patient will have the implant in his or her body for the rest of the patient's life. So it has to be perfect. It has to be a commercial-ready product when we implant it into the first patient. So that's why we need to be so super thorough with all the testing. It has to be perfect.
Okay. Any more questions? Yeah.
Yep. Pardon? We think so, yes. It's very likely. The US is, as for many companies, the US is the by far biggest market. We have a US first strategy. It's really nice to have this breakthrough device designation from the FDA. It helps us a lot. We get this dedicated group and sprint discussions. It's also very likely that we can get this new technology add-on payments, the NTAP, for this product. But we will also look at EU. So the approval study will be Europe and US, majority being US. That's the next study. Yeah. More 100 or 150 patients.
Is that so many patients you think you need to get an approval to actually roll out?
We think so, yeah.
Yeah.
We
So
think it's in that
150.
range, about 100, 150 range.
Yeah. Okay. What about the patent for this product? How have you secured your technology?
Yeah, we were lucky. So when we founded the company, I was the first investor, John and me. And then we spent all those money and a lot of time to write the first patent. And we were lucky when we submitted it, because we had a really large corporation that tried to do something similar right after us, so only a couple of months after us. And we had written it so well that they got so much pushback towards our patent that they actually abandoned their complete application. And then we have submitted lots of follow-on patents, add-on patents, and also new families to secure. So it's very well patented.
How will you find patients for this? Is that through patient? I don't know if you call it that in English. Patient organizations, or how will you reach out?
Yeah, then you have to partner with the right hospitals and the right doctors.
Yeah. Okay.
So we think it's since it's such a common surgery, we think it should be possible to do like a 10 or 15 patient study with only 2 sites here in Sweden, as an example. You can have it here in Gothenburg and 1 site in Stockholm. That's what we're looking at.
Okay. Who are the owners? I've heard of you 2 guys, but the rest of the company, who are your major owners?
The company was founded, so the brain behind the system is not me. It's John's little brother. And that's the reason I invested, because I knew he was a super genius, right? He was at the time, doing his PhD at the Washington University in St. Louis. And his domain was neuromodulation. So that's where he's from. That's the technology that we now add to spinal fusion. So he became friends with a really good, ambitious Irish neurosurgeon, Dr. Rory Murphy. Rory is now active at Barrow Brain and Spine in Phoenix, becoming a superstar over there. So they founded the company. John and me invested, and then we got lucky to being able to call ourselves co-founders, right? So that's the 4 co-founders. Then over the years, we have gathered in investors, obviously. We raised about 10 million. We have small seed stage investors, VCs. SOSV has joined us as an example for every round. And then we have multiple family offices and business angels. It's about 100 in total. But not on the main cap table. We were pretty smart, so we set up an SPV pretty early, where all these go through.
Okay,
I can. Sorry.
Yeah, sure.
If I can add,
Go on.
one important thing to mention is we have tons of neurosurgeons on the cap table. The surgeons really want this technology to come to the market, and these are often American. So John and me, we had a little US tour in October. We met with multiple neurosurgeons, and they just love this. Everyone wants to test it first. Can we be the first center? Can we be the first center? And then they invest. Right. So the market surgeons, they really want this to happen.
You see a strong interest.
Huge interest. It's super motivating to do those trips when you can actually see it.
What about funding? I mean, go into this clinical trials. It sounds like you seem to have quite expensive years ahead. How will you raise money?
The hardest part to raise is now before you have clinical data, right? This is the valley of death that we need to cross. So we raised the first portion of the A round. We raised just after last summer. We raised 2.2 million euros in new money. We converted 4 million euros we had in outstanding convertible loan notes. And now we raised the second tranche done of the same financing, same term, same valuation, everything, which is crazy, but it's the way it is. And we have then the potential to take 7.8 million more. It's already approved by the shareholders at the same terms. And as I said, we need minimum 5. That's a minimum. 5 million euro would take us all the way to actually test it in these first 10 patients and to evaluate the data. And then we need a much larger round. But that one will be easier because then you have clinical data. Hopefully it's as good as I think it will be, right? Yeah. And then we have like tons of big investors lined up already now.
I mean, we don't have that very strong market now, but an IPO, is that of interest for your company? Or do you think you should stay private going forward?
I think IPO is a good option later. So what I think would make sense is to raise this Series A private through family offices and business angels, and to raise the Series B is more interesting because then it's more like a 20-30 million euros that we need. I think it could make sense potentially to do that as a pre-IPO, and then do the actual IPO at point of commercialization and approval.
Okay. If everything goes, if the sun is right, how many years until we can see this actually in hospitals? 2031. Okay. Yeah.
Should be the that's the date we're targeting.
Yeah. Yeah. And yeah, sure.
I'm just connecting that because you foresee basically 2 studies. Is it the first one now and then a more major one for?
Correct. Correct. Yes.
Okay. And I mean, what challenges do you see? You seem well funded. Is it to find patients, or I mean, of course, I mean, clinical evidence is of course, but if you run a company, I guess you're looking for.
Yeah, in all honesty, the biggest challenge and threat that I see is the finance risk. Okay. It's actually to make sure that we can secure the finances that we need now to actually get it into humans. Then I think it will all be completely different story, much easier. But that's the biggest challenge I see and threat I see right now, that you cannot find and secure the financing you need.
How will the business be in the future when you have the clinical evidence? I mean, where will you place yourself in the ecosystem?
Myself.
No, the company is. Are you gonna sell directly or gonna work with
That-
other companies?
That's a really good question. If you know how these implants are actually sold in real life, they have so the big companies, they have sales reps out on actually assisting throughout all the operation. So they stand there. We watch the surgery and like the sales rep looking this and looking at all the like helping the surgeon to look at the pictures and the X-rays and everything, and then supplying everything that the surgeon needs, and then doing all that. It's pretty hard to set up such an organization by yourself.
Yeah.
So the answer is definitely to partner with someone. It could be one of the bigger players. It could be through like one of all the distributors that are out there, or like a multiple selection, one for each like course or something. But that's the way you need to set it up. Or you could also imagine like selling the spine, like the first business, and then continue to produce all these new implants. It's so many options, and it will be extremely fun to evaluate, what would work best. But it's a question for a little bit later.
Yeah, of course, it takes time. Do you have any key opinion leaders that work with this, or?
Yes, I could have. Of course, I've included a slide. We're working with some of the best surgeons and key opinion leaders in the world. So we're like the surgeon who did Tiger Woods' spinal fusion surgery. He's on the advisory board. It's mainly Americans.
Yeah.
Now, since we are building the company here, we also want surrounding us with with Swedish people. So who would like the best surgeon be? We found Dr. Gunnar Nemeth, who was the CEO of Capio. He was also co-founded Ryggkirurgicentrum RKC in Stockholm Spine Center, and is a professor in orthopedic surgery. So like a perfect guy for this. He has both the domain knowledge and also the business knowledge. So he's on the advisory board. Magnus Nilsson, Blåvitt's new chairman, and also the former CEO of Vitrolife and Xvivo, is on the board. And then we have, so it's like the best people.
Yeah, quite a strong lineup.
It is. Yeah.
It sounds like that. Thank you very much. I don't have any more questions at the moment. Thank you for a very interesting presentation. If we don't have any more questions. No? Yeah, one, of course.
Yeah.
You mentioned the financial risk. So how are you looking for the money? You mentioned also that you had VCs and business angels.
Yes.
But no accelerators, no Almi, no nothing.
We have received the EIC grant, 2.5 million euros in grant. So that's one of those that we already did receive and spent. And I think at this point now, since it's a bit too small for the larger VCs, for most VCs, and we are not in a position where we could actually use 20 million euros. 10 million I could use. So so how we're raising money, we're doing like this, presenting and meetings. I think if you guys would come and visit us and actually meet the team, much better than I am, right? Who actually constructs these things, and to actually see the product, because it's complete. When we show it now to the surgeons, they say, yeah, it's ready to go, even if it's not, because it's some things we need to fix with it, some smaller, minor things, but it looks ready to go. And the technology, like this wireless powering of the system, we can show it here if you come and visit us. Yeah, so that's when we really get people super interested when they see it. Yeah.
What's the valuation in this round?
25 million euro pre-money. That includes then the conversion of all the outstanding loan notes that we have. So that's already done. Also, pretty big expansion of the option pool, so we can do all the future employees that we need to hire. But the team we have now is complete. So we are 11 people, and it's complete for the stage we're in. We don't need to hire anyone more to reach the first clinical. So it's a full team.
But it's you will be funded until the clinic starts, or
until
the trial starts, or
yeah, until after we have the data.
Yeah, okay.
So we can raise the Series B while we have the data.
Yeah. Okay.
Yes.
Thank you very much, Martin.
Thank you guys very much. It's been great presenting.